said no pain, no gain.
I think you'd be surprised at how crazy it is to actually witness a jaw surgery, and I should know because I almost passed out in the middle of one during my orthodontics residency. That's right, when you're going through dental school and orthodontics residency or whatever, you've got to go through the different piles. So you have to see what it's like to be an oral surgeon, a general dentist, an orthodontist, an endodontist, and do all the different specialties to see what you want to do. But in orthodontics, we work really closely with oral surgeons, particularly in jaw surgeries, because if you have a jaw surgery, not only do we need to fix the bite with the jaw surgery, but then we need to make sure the teeth and stuff are straight and looking good too. So we work together a lot. So in residency, they said, hey, come on, I want you to shadow and I want you to scrub in and, get all good. And I want you to watch this entire jaw surgery from start to finish. So we get in there, we feel all big and bad because we're in a hospital witnessing a jaw surgery. This is crazy. And so we get started, okay? And I didn't realize that this surgery lasts a long time. This thing's not like a 30-minute surgery. This is like a multi-hour surgery. So you got to get ready for it, okay? And so too, they're up in there, they're cutting away, they're doing everything. And one of the other cool things is I didn't realize is that they have little nerves. I always wondered, how do you not hit all these nerves? Well, they actually have like this little metal thing that they'll go through and they'll test, and it'll beep if it hits an electronic nerve, so they know not to cut that nerve. I mean, because a blood vessel, tendon, and everything, they look so similar that you just got to really test it. So that was the first cool thing. But about an hour and a half in, the head professor, the big wig, the guy who's done thousands of jaw surgeries, he said, hey Ben, you want to see something cool? Come on over here. And so at this point, they had lifted up here, they had lifted up the gum tissue, and if you don't know, in a jaw surgery, they have to basically kind of cut the entire top jaw off your skull. So you have a skull, we all know our skull, and then attached to it is our maxilla. It's attached to your skull. Your lower jaw is actually completely detached. It's just sitting inside the faucet. That's why if you had a skull, you could just take the mandible off if there was no ligaments and tendon. And he looked me dead in the eye and he said, have you ever seen somebody remove someone's upper jaw from their skull? And I was like, yeah, of course. I've seen that plenty of times. No, I have never seen it. And this was the first time ever witnessing said thing happen. And so he said, I want you to get really close because I want to see your reaction to this. Come on, come over here. So I get really close and he puts one thumb here on one side, one thumb here on one side, and he gets his whole leverage of his whole entire body in there. He says, okay, I want you to count to 3, okay? 1, 2, and then he just goes, and he just absolutely pops. This is like the cut right here. It was like completely popped and ripped off the top jaw off of the skull. Now, not only was I physically in shock at this point and probably turning white because I just witnessed somebody get like semi-decapitated, but anyways, afterwards, he was showing me how cool it is that, hey, look at this. It's just floating in space. I can move it up, down, left, right, up, down, all over the place. And that's because the bone was cut, but it was still attached through skin and everything else, so it was literally just floating there. Like if you open his mouth, his teeth would just go, like just fall around. You could totally move it. And that's actually how they move your bite. So if you have a big underbite like this, they just detach it from your skull, drag it forward, and then plate it in like that. I had no idea. I don't know what I thought happened, but I didn't think that. So is oral surgery an amazing and a technical feat and achievement that has changed people's lives and faces forever? Yes. Does that make it any less disturbing? Absolutely no. And do I want to see it again? Kind of and kind of not at the same time. I don't know. Would you want to see an oral surgery? Let me know down below.